friends, that they're acting out in violent ways. There's been research recently, in fact, just the last month, a report was released from Duke University of the long-term effects of being bullied, that students who were bullied even for one of their school years, up until adulthood, suffer from depression, anxiety, that there's a direct connection between the ability to earn an income. For students who do bullying, there's a direct connection between getting into trouble as children, in alcohol and drug abuse later in life. So there are things that are happening at that young a level that we can see all the way up into adulthood. That, again, I'm glad that we were invited here today because it really makes me see the importance of what we're doing right now and what we can do in our schools and how this program is addressing this from such a multi-tiered level. If you want to find more information on it, our website has quite a few links to different bullying prevention information, how to talk to students about it, how to talk to teachers about it, what a community can do to support our schools. In fact, one of our committees said, gosh, we're doing such great work here. We want people to know about it. So what can we do to get people to know that we really are trying and that we do care about our students? This idea that teachers don't care is, I have learned in the last year, is absolutely not true. The amount of work that I see these teachers doing, because they know that by creating a positive classroom environment, their students are going to learn. In the long run, I think that's a huge piece of this program, not just the learning they can do academically, but the social emotional learning that they can accomplish by this being addressed. As part of the program, every classroom will have a weekly classroom meeting that discusses social emotional learning. So sitting down with students, grades kindergarten through second grade, it's about 15 minutes, 20 minutes for older students. In the high school level, it's a full class period where they will be sitting down and talking about whether it's bullying or friendship or dating, but social emotional learning. And the schools that are signing on for this in this 5-county region will be doing that from here on out. Once they kick off, this is going to be something our students are exposed to and our teachers are exposed to also. One of the program's components that we do, and I think listening to what you were saying about knowing what to do and where people want to be and what should they do, it's called the bullying circle. It's a role play. So we have someone who's being bullied, you have the person who's doing the bullying, their supporters, someone who maybe is standing and laughing, not saying anything. You've got the person who's just shaking their head and thinking, this is none of my business. You have the person who actually steps up and jumps in and does something about it. After we do the role play, we ask everybody in the room to stand up and say, where do you see yourself in this bullying circle? Every single time, everyone's over there with either the defender or the person closest to that defender wanting to be able to do something about it, which really shows that people want to help. It's just having the tools and knowledge on how to do it. And I think, listening, how can we pull that together between not just schools and youth, but how do we teach the older community, the working community, how they can step in and give them those tools to do that? Would be a great step.
Thank you for inviting us here today. I want to talk to you about elder abuse, and in light of all the different months we've been highlighting, this is Residents' Rights for Persons in Nursing Homes Month, and their theme this year is Elder Abuse, Speak Up. So the theme is running through all of our positions here. I was at a conference this summer, the Elder Abuse Summit, that's held here every year. It's not here, but in Grand Blanc, Michigan. And so I wanted to bring you some statistics back from that conference. Maura Corrigan was there, and she's the director of the Department of Human Services. And she talked about abuse of vulnerable adults as one of the fastest growing crimes in our state. Their office last year received 25,000 calls about elder abuse or vulnerable adult abuse. And that does not include calls that were made to 911 or police departments. Of those calls, 60% were people over 60 years of age. And of that 60%, so it would be 9,000, were from women over 60 years of age. So the thread continues, just as Kathy was talking about. Women are the highest percentage, but by no means they're not the only group that's addressed by this. Dr. Laura Mosqueda was there. She is a geriatric physician in California. She also does research at the University of California, Irvine, and she was the keynote speaker. She talked about people 85 years and older as being the most vulnerable for elder abuse, and that 50% of that age group, seems like a lot to me too, but it seems like have dementia. So they either have mild cognitive impairment, moderate, or severe dementia. And 50% of the people with dementia have been mistreated in some fashion. Adults with disability are disproportionately more at risk for being abused. And when caregivers are questioned about mistreatment, she said her research shows that they often will admit that they have done something wrong. For every one act of elder abuse or incident that goes unreported, or that is reported, 23 are unreported. So I think the issue is pretty huge. Elder abuse is some act that is intentional or negligent, and it may cause a person harm, but it's still abuse if there's potential for harm. And some of the forms you've heard today, especially Kathy talking about, number one for elders is neglect, followed by physical abuse, financial exploitation or abuse, emotional or psychological, which could be verbal abuse or just threats, people who are abandoned, or self-neglect as people get older. And most at risk, it can really happen to anyone, and that's why it should concern us all. It could happen in our family, to us, to a neighbor. When we're in that age group, or if we are in that age group, it can happen to us. And like Kathy said, it goes across all groups, socioeconomic, culture, races. Can happen anywhere, in our home, in institutions, nursing homes, where I visit regularly, assisted living facilities, any institutional setting, and it can even happen in hospitals. And again, the available research, which there isn't a lot on elder abuse, women or women over 80 are most likely to be victimized. So we talked about some of the common risk factors. We mentioned dementia already. But if the individual who's being abused or the abuser has mental health issues or has substance abuse issues, people are at higher risk. And those people who are socially isolated, maybe living with a family member out in the country, they aren't allowed to have visitors, or anyone who's in poor physical health, because if you can't protect yourself, that makes it a lot harder to avoid elder abuse. And how big is this problem? We don't really know, but you can see from the estimates that it's probably pretty big. And more research needs to be done. There's been a lot of research on child abuse, and they're kind of using that model as they do elder abuse research. But many of the studies really don't show us what exactly is going on because there just hasn't been enough research. One recent study that I heard quoted, 11% of elders have been abused or mistreated, but that study did not include anyone with dementia or anyone in an institutional setting, so we know that number is low. So elder abuse continues to be under-identified and under-reported. And the reason it's an invisible problem is because some of the reasons that Kathy noted, but it often happens behind closed doors. This is not something that you see out in the public often. You might, but most often not. And people are reluctant to report. They feel ashamed, they're embarrassed, especially if it's happening by a family member or somebody that they trust. They're afraid the abuser will get into trouble. They worry that they might have to move. And a lot of people, if they're older and infirm, they think, if I can't stay here, I'm going to have to go to a nursing home. They may feel guilty or that they're to blame. They may be in denial that this is really what's happening, that they are being abused. And they might just be unaware of what abuse really is. I think emotional and verbal abuse often gets misidentified and not recognized as abuse. And people can be afraid to report because they fear the abuse will get worse. So there are many mandatory reporters in Michigan, and you can find those on the website. It's usually medical personnel, dental personnel, social workers, EMS people. But a lot of times, mandatory reporters don't always report what they see either because they're not continuously trained and re-educated and made aware that they really do need to do this. This isn't just something written down on a piece of paper. Persons with dementia are at risk because they can't speak out for themselves, or if they can, because many people with dementia do have the ability to communicate their feelings with us. Often they're not believed because they have that label of dementia. So research is going in the direction of looking at ageism and how as we age we get more marginalized, and that's maybe one of the reasons why elder abuse is more invisible or something that is not seen as important as it should be. So what can we do to prevent this? I have the statewide elder abuse number that you can call for any suspected abuse, and you don't have to prove it, you don't have to investigate it, you don't have to make sure that it really, really is abuse, you just have to suspect it. As Kathy talked about, that person who is documenting and putting dates, if you suspect it, you should call 1-855-444-3911. That is the state intake number for every county. And of course, if someone's in a life-threatening situation, you need to call 911. You can learn more about the issue. There's an excellent website called the National Center on Elder Abuse, and their website is www.ncea.aoa.gov, and you will get linked to tons of information. You can be aware of family, friends, neighbors, and just get in touch with elders that are in your neighborhood or in your company. A new national elder justice campaign group is formed called Ageless Alliance, and you can become a member of that group. They are also associated with University of California, Irvine, where Dr. Mosqueda practices. There's World Elder Abuse Awareness Day every June 15th. You can find out more about that on the website. And Michigan has started a model called the Vulnerable Adult Protocol. And this is going to be a blueprint for all communities in our state to implement in each county. The Prosecuting Attorneys Association of Michigan has been contracted to do training in all 83 counties to help develop investigative teams to work on this issue of elder abuse. The goal is to reduce harm and to increase prevention. And it's being shared, as I said, in all 83 counties. On October 17th, there will be a training in Gaylord, I believe, Gaylord. And this is for the top tier counties. On October 15th, the UP counties are meeting for a training. So this is a way to get all the core groups together, to work together, to set up a protocol so we can standardize and make identifying, investigating, and prosecuting elder abuse more effective in Michigan. So finally, I want to say that baby boomers, and I'm sure most of us here are baby boomers, have been that activist generation. And I don't want to offend anybody here. Anyway, we have been that activist generation. And I think we've created a lot of social change. And so I think we're still here and hopefully ready to create change as it relates to prevention and reduction of elder abuse. So thank you.
Thank you to each of you. That was so interesting. And if anyone has a question, I saw Carla back here, and then Betty next.
So I have a question regarding your services that you offer. How do you serve the Hispanic population?
At Women's Resource Center specifically? We don't.
How do we serve Spanish-speaking clients at Women's Resource Center? Currently, we do not have anyone on staff that speaks Spanish. However, we do have access to translation services so we can bring someone in that can assist. And for example, my office in Leelanau County is in the Connie Binsfield building, so I very luckily have the opportunity to be next door to Ricardo from DHS, who's a fluent Spanish speaker. So I've accessed him from time to time when I need assistance in Leelanau County.
And then I have another question. I'm from Cincinnati, and human trafficking was huge in that area. Is that something that, do you have any victims in this?
I'm sure we do. It's because...
What is the question?
Oh, I'm sorry. The question is about human trafficking. She said she came from the Cincinnati area where human trafficking, especially across mid-America,
yes,
and some of those routes is huge. And in Miami, huge. Up here, I'm sure there are victims, or there are people that have escaped up here to hide for whatever reason, as far as why they've chosen to come to northern Michigan to hide. I don't know of any clients specifically that have mentioned, but that does not mean it doesn't exist. I think though, because we're not on those routes, it's a lot less likely here.
Something I would like from each of you, you mentioned various websites or phone numbers where people can contact. I would like a list of those so that we can distribute those to our membership on an email, perhaps, if we can do that. Betty was next, and then Marianne, and then Betty.
I would just like to know, it sounds, elder abuse sounds so much like bullying of the elder. Isn't there a way that those two resources working on those problems could be combined and finding solutions a little easier? Or what is the difference between elder abuse and bullying? It sounds a lot alike.
I think you're right. I think that the question is the similarities between elder abuse and bullying, and can the same resources be used to address both issues? And I would think so. I would think that making sure that people are intervening, that people who intervene know how to intervene and who they should go to is very important. I think a lot of abuse is about education, so having the education not only for the person who's being abused, but for the abuser. I think quite often people don't realize what they're doing is abuse. So education for caregivers to know is their behavior appropriate. And yeah, I think the model could be used and the training could be used either way. So training people who are caregivers would be a great idea.
Yep, I think we should look at the bullying program and see if that's something, maybe I can get some information. And we can look at that, especially in that task force, the Michigan model that they're working on. I mean, maybe they already have those materials, so I haven't been to the training yet, but I think that's a really good point.
this is for Nancy.
Okay.
Um,
Marion, go ahead.
Who are the prosecuting attorneys training?
They are, I don't know if I have the sheet with me,
Who's
but
going to the training?
Department of Human Services workers, so Adult Protective Service. I think police have been invited, local prosecutors, anyone involved, probate court, anyone that would be involved in the elder abuse. I don't have a list with me right here, but I can certainly send that along in an email. But anyone that would be part of that team. Now, I just emailed the state, because the deadline to sign up was the 30th, and asked if I could attend. And they said they would be happy to have me attend, so I will be attending. So anyone that works with elders too, that would be in an advocacy role like that and protecting, but I can get that information if you would like it.
That question was, who is being trained? That, yes. And then this lady back here in the tan.
My question is for each of you, and it is this: how is the sequester going to affect your ability to offer programs and education, all these things that you are doing and planning?
The question is, how is the sequester going to be affecting each of these people and their programs?
At Women's Resource Center, because we're funded through grants, private donations, it's not going to directly impact my services as far as what I'm going to be able to offer clients in time. It will obviously impact possibly access to resources, because a lot of what I do, I'm an advocate, so I advocate for my clients to access affordable housing, to access food, medical care, and all of those kinds of things we know, are being impacted.
I think our answer would be the same. Fortunately or unfortunately, we don't receive federal funding for this program. The federal government is doing a lot of research and review on bullying. There are different laws being reviewed about who is responsible when bullying happens. In fact, 2012 saw the highest rate of court cases where liability to either schools or parents was upheld within the court. So laws are changing and the federal government is looking at it, but as far as what we are doing locally, it does not affect us.
So far, the sequestration affected the whole ombudsman program throughout the state. So a little bit of funding was affected in our area. How the shutdown will affect us if it continues, remains to be seen. But again, like everyone said up here, different resources are being affected, and I think if it keeps lasting much longer, I think we'll really hear about a lot more.
Thank you.
Yes, there's one question here, and I have a question for Officer Morgan.
Yes, Nancy, on the whole issue of caring for the elderly in places that are, dementia or whatever, a lot of these people are very poorly paid. They're often working more than one job. What do you know, or what is being done to explore this problem on the elder situation?
Okay, the question was, the people who work with elders often are low-paid employees, and so what is being done to kind of alleviate that? Does that kind of summarize your question?
Yes, we're fortunate to have in Michigan the Paraprofessional Healthcare Institute, and their sole role is to advocate for lower wage workers, including direct care workers who are in nursing homes and other long-term care settings. They advocate for health care, they advocate for increased wages, and you can find a lot of information, Paraprofessional Healthcare Institute on the website. I can include that in what I send to the league. And but they are actively addressing that issue and working hard on it right now.
Marion, and then Mary.
I'd like to
I thank you for all the information, and I think you're right that a lot of us in the room are, you know, either current activists or in our earlier lives were very active and want to do things to help. But if any of you could give any suggestions, if you're actually seeing abuse, bullying, or mistreatment happening in the moment, you're there, visiting your grandmother at the nursing home, or seeing kids interacting, or seeing verbal abuse between spouses, any simple tips that we can just do in the moment to try and intervene to at least put a stop for that particular event?
What can someone do who is witnessing bullying or elder abuse or whatever taking place? What do you suggest as tips for those people?
In regards to domestic violence, you specifically said verbal abuse. So verbal emotional abuse, if you witness that and it happens to be someone that you have a relationship with, it's best to not intervene at that moment because you could possibly escalate that individual. So once it's behind closed doors, they will become more violent. However, if you witness any kind of physical violence, which has happened in our community, we've had bystanders at bars, at hotels, on the street, call 911. You know, where cell phones grabbed out of someone's hand and they're slapped across the face, that's a time to call 911 and get help. But it is very different when it's people you have a relationship with and you're witnessing the emotional and verbal abuse. That's the time to, when you have a moment with the victim alone, to provide support, understanding, and information. But don't intervene at that moment unless you think it's going to escalate physically, because it's very likely you will cause an escalation behind closed doors.
Within a school setting or with children, as an adult, we recommend that every adult intervene. And each adult at each school is being trained on how to intervene. And it's simple stepping up to two kids who are in some kind of bullying situation and saying, hey, what I just saw is not okay. We never ask, are you okay? Because then you're putting that person who's in the power imbalance in a position where they can either say, you know, no, I'm not okay, and their power goes down lower, or lie and say I am okay when they're not. But simply stepping in and saying, what I'm seeing is not okay, and I'm going to follow up on this. And then separating the two. And the follow-up, I think, is huge, because you want to make sure not only the student who was bullied is followed up with, to make sure that they are okay, to find out how often has this gone on, is it happening anywhere else, but with the student who is bullying, to make them aware that their behavior is inappropriate and that there are consequences for that. So with students, even with older students, if you feel comfortable intervening, if it doesn't feel like a dangerous situation, saying that that behavior is not okay.
I will speak to long-term care, because elders in the community, that would be exactly what Kathy recommended that you do. But if someone's in a nursing home and you see some abuse, actually in a nursing home, staff, if they witness some abuse, if they witness a coworker, they are required or mandated to report that directly to their supervisor. The supervisor has to report that to the administrator, and it has to be reported to the state of Michigan within 24 hours. I'm seeing a lot of citations, you know, they're finding out after the fact. Some homes are finding out that they haven't reported when they should have reported. So they're being cited by the state of Michigan. So it's a regulation that's been around for a couple years, and if you see something, you should go to some supervisor, the charge nurse, the administrator, hopefully, and report it immediately.
Last question, Mary Tonneberg.
It's really picking up on what Marion asked, but across all these situations, what's the psychology in the general population of stepping back and not wanting to get involved other than a physical danger situation? Like, it's not my problem attitude.
How often do you see a bystander saying it's not my problem and not intervening?
In regards to domestic violence, it really depends on the culture of that community. It depends on that family, the religious background, so it's incredibly varied. For example, when I lived in Miami, even though we would read in the paper too often, far too often, that women were being killed by their spouses. If you talked to many people in the community, they would tell you, well, domestic violence doesn't really happen here, it just happens to people that have problems. Here in northern Michigan, what I find is, domestic violence is kept quiet because that's their business. Let them have their business. I'm not going to get into their business. So I may be aware it's happening, and I may admit that domestic violence happens, but that's their dirty laundry to take care of. But I'm not going to get into their business. I hear that often.